Tuberculosis, or TB, is a serious infectious disease caused by Mycobacterium tuberculosis bacteria. These bacteria primarily attack the lungs, but they can also invade other parts of the body such as the kidneys, spine, and brain. TB has been affecting humans for thousands of years, and despite medical advances, it remains a major global health challenge. TB spreads through the air when a person with active TB disease coughs, sneezes, or even speaks, releasing tiny droplets that contain the bacteria. These droplets can be inhaled by others, making TB highly contagious, especially in crowded or poorly ventilated spaces. Interestingly, not everyone who is infected with TB bacteria becomes sick right away. Some people develop latent TB, where the germs remain inactive in the body and cause no symptoms. However, latent TB can turn into active TB if the immune system weakens, so monitoring and treatment are important. Despite being both preventable and curable with proper medication, TB is still one of the world's deadliest infectious diseases. It hits hardest in low-income countries, where access to healthcare, nutritious food, and safe living conditions can be limited. Millions of people are affected each year and many lose their lives. World TB Day, observed every March 24th, is a global event dedicated to raising awareness about tuberculosis. It marks the day in 1882 when Dr. Robert Koch announced his discovery of the TB bacteria, a breakthrough that paved the way for diagnosis and treatment. This day is a time to educate the public about the impact of TB, honor the memory of those who have lost their lives, and inspire people everywhere to take action. It's also a moment to recognize the ongoing efforts of healthcare workers and researchers fighting TB worldwide. World TB Day helps fight the stigma that surrounds the disease, encourages people to get tested and seek treatment, and shows support for those affected by TB and their families. Open conversations and community support are key to overcoming fear and misinformation. The day also calls on governments and organizations to increase funding, improve healthcare infrastructure, and invest in research for better diagnostics, treatments, and vaccines. Strong leadership and commitment are essential to ending the TB epidemic. By uniting as a global community, we can share knowledge, strengthen health systems, and push for better tools to fight TB. Collaboration across countries and cultures is vital to making progress and saving lives. The ultimate goal is a future where no one suffers or dies from this preventable, curable disease. A world where TB is finally a thing of the past. World TB Day traces its origins to a pivotal moment in medical history, March 24, 1882. On this day, Dr. Robert Koch, a pioneering German physician and microbiologist, made a groundbreaking announcement. He had discovered the bacterium responsible for tuberculosis, known as Mycobacterium tuberculosis. This revelation was a turning point that forever changed the course of medicine and public health. For centuries before Koch's discovery, tuberculosis was a mysterious and deadly disease, often called consumption, because of the way it seemed to consume its victims. People lived in fear, as the cause and cure were unknown. Koch's work not only identified the culprit, but also opened the door to new methods of diagnosis, prevention, and treatment, giving hope to millions. Fast forward 100 years to 1982. To mark the centenary of Koch's discovery, the International Union Against Tuberculosis and Lung Disease proposed that March 24th be recognized as World TB Day, a day to reflect on progress and renew the fight against TB. The World Health Organization, along with global partners and advocates, quickly embraced this idea. Together, they transformed World TB Day into an official public health campaign, dedicated to raising awareness and mobilizing action worldwide. The date is more than just a commemoration. It's a tribute to scientific progress and a powerful reminder of the ongoing battle against TB. It honors the scientists, healthcare workers, and communities who have dedicated themselves to this cause. Over the years, World TB Day has grown into a truly global event. Each year, millions of people from all walks of life come together to share stories of survival, recognize the tireless efforts of healthcare workers, and launch new initiatives aimed at ending TB once and for all. It's a day for advocacy, for demanding accountability from leaders, and for renewing our collective commitment to a world free from tuberculosis. Communities organize marches, educational events, and campaigns to spread awareness and push for change. The history of World TB Day is rooted in scientific discovery, but its true spirit lies in the power of collective action. It's about people coming together, across borders, backgrounds, and beliefs, to fight a common enemy. Each year, World TB Day serves as a bridge, connecting our modern efforts and innovations to that historic moment when science first gave us hope. It reminds us that progress is possible when we work together. Today, World TB Day is a vital platform for launching new initiatives, sharing research breakthroughs, and holding leaders accountable for promises made. It's a day when the world's attention turns to TB, and the call for action grows louder. The legacy of World TB Day is one of hope, resilience, and determination. A global movement striving for a future where no one suffers from tuberculosis. The main goal of World TB Day is to raise global awareness that TB is still a public health emergency. It educates people about TB's risks, symptoms, and prevention, making the disease visible and building support for action. The day promotes prevention, early testing, and effective treatment, emphasizing that TB is both preventable and curable. Reducing stigma is crucial. World TB Day encourages patients and survivors to share their stories, challenging harmful stereotypes. The message, TB is a medical issue, not a moral failing. Another key goal is to mobilize political and financial support for TB programs and research. Governments and donors are urged to invest in healthcare systems and new tools. Without sustained investment, progress could stall and gains could be lost. World TB Day is a call to action for everyone, leaders, communities, and individuals. Together we can end TB. Tuberculosis, or TB, continues to be one of the world's deadliest infectious diseases, claiming more lives each year than even HIV/AIDS in recent times. Despite decades of progress, TB remains a persistent threat, affecting millions of people across continents and communities. Every single day, over 4,000 people lose their lives to TB, and nearly 30,000 more are diagnosed with this curable disease. These numbers are not just statistics. They represent real people, families, and communities facing unimaginable hardship. The burden of TB falls heaviest on low and middle-income countries, where access to quality healthcare is often limited or out of reach. In crowded cities and remote villages alike, people struggle to get the help they need, but TB's impact goes far beyond health. It devastates families economically, forcing many to spend their savings or go into debt just to afford treatment. For some, the loss of a breadwinner means falling deeper into poverty. Treatment costs, lost income, and children dropping out of school to care for sick relatives create a vicious cycle that is hard to break. The ripple effects can last for generations, affecting education and future opportunities. Yet, there is hope. TB is both preventable and curable when people have access to the right tools, medicines, and support. Early diagnosis and proper treatment can save lives and restore hope to families. Tragically, many still die because they are diagnosed too late or cannot reach a clinic in time. Barriers like distance, cost, and stigma keep people from getting the care they desperately need. Ending TB will take a united global effort. It means investing in stronger health systems, training healthcare workers, and ensuring that everyone, no matter where they live, can access life-saving care. The fight against TB is also a fight for social justice and economic opportunity. By tackling TB, we address inequality and help communities build a healthier, more secure future. When we invest in TB control, we invest in stronger, more resilient societies where everyone has a chance to thrive. The benefits reach far beyond health. They touch every aspect of life. The numbers may seem overwhelming, but the solutions are within our grasp. With commitment and collaboration, we can turn the tide against TB. Together, we can break the cycle of suffering, restore hope, and save millions of lives for generations to come. The World Health Organization's End TB strategy, launched in 2014, aims for a world free of TB by 2035. Its targets, a 90% reduction in TB deaths and an 80% drop in new cases by 2030. The strategy focuses on patient-centered care, bold policies, and intensified research. No family should face financial ruin because of TB. Ending catastrophic costs is a core goal. Countries are encouraged to adapt the strategy to their needs, ensuring no one is left behind. Political commitment, increased funding, and community engagement are essential. Innovation is key. We need better diagnostics, shorter treatments, and a new vaccine. The End TB strategy is a roadmap for global action and accountability. Progress is measured by clear milestones, driving urgency and focus. Achieving these goals will save millions of lives and transform public health. The vision: zero deaths, zero suffering, zero TB. Major challenges remain in the fight against TB. Diagnostics are outdated. Many places still rely on century-old microscopes, missing cases. Treatment is long and difficult, leading to incomplete courses and drug resistance. Drug-resistant TB is harder, costlier, and deadlier to treat. Access to care is limited for the poor, rural, and marginalized. The only vaccine, BCG, is over 100 years old and not effective for adults. New tools, shorter treatments, and a better vaccine are urgently needed. Overcoming these barriers requires investment, innovation, and reaching the most vulnerable. Ending TB demands strong global partnerships. Governments must lead with robust TB programs and funding. NGOs and civil society reach vulnerable groups, fight stigma, and support patients. Patient advocates give a human voice, holding leaders accountable and shaping policy. Scientists and researchers drive innovation, developing diagnostics, treatments, and vaccines. Collaboration between public, private, and academic sectors is vital. Initiatives like the Stop TB Partnership ensure new tools are accessible and affordable. Frontline healthcare workers are the heroes, delivering care in tough conditions. Community engagement spreads accurate information and encourages care seeking. Together, these partnerships form the backbone of the global fight to end TB. On March 24th, communities worldwide mark World TB Day with action and awareness. Free health camps offer TB screening and testing, reaching those who might not visit clinics. Educational events in schools and communities bust myths and teach prevention. Public rallies, marches and vigils honor lives lost and demand action from leaders. Social media campaigns amplify the message, sharing facts and stories globally. Online webinars and Kwandas connect people with experts and survivors. These activities unite people, raise awareness, and push for change. World TB Day turns knowledge into action, inspiring hope and solidarity. Each World TB Day is guided by a theme, rallying the world to act with urgency and hope. Recent themes like "Yes, we can end TB" inspire leadership, investment, and innovation. The COVID-19 pandemic disrupted TB services, reminding us progress is fragile. Building resilient health systems is essential to withstand future crises. Despite setbacks, scientific advances and global commitment offer real hope. New diagnostics, shorter treatments, and vaccine research are accelerating progress. World TB Day is a moment to reflect, recommit, and act. Ending TB is possible with sustained investment, research, and equity. If we work together, governments, scientists, healthcare workers, and communities, we can create a TB-free world. The time for action is now.